Are you worried about your baby's pronunciation? Your baby is not talking well? Is there any stammering problem? Then you must look for tongue tie. I am Dr. Kalpesh Patil. I am Pediatric and Neonatal Laparoscopic Surgeon practicing in Pune. When there is a anterior 1/3 part of the tongue is adhered to the base of the jaw, floor of the mouth with a membrane that is called tongue tie. Because of the tongue tie, the movement of the anterior part of the tongue is hampered and baby cannot touch the tip of the tongue to the palate. While pronouncing few words, you require the touching of that tip of the tongue to the palate. When there is a tongue tie, baby will not be able to pronounce very clearly. Also, there will be stammering problem. So when you are getting problem like delayed speech, when you are getting problem like altered pronunciation of some words or stammering problem in your baby, you should get it evaluated for the problem of tongue tie. On only oral examination, you can identify this problem. Why you should be worried about it? If you don't operate tongue tie at one particular level, then throughout the life, the baby will learn to pronounce that particular word in the similar fashion. If you don't operate this particular disease, then baby will learn to pronounce the similar word in the same fashion what he is doing since birth. How you are going to cure it? It is very easy to treat this disorder. Previously, it was done with the open surgery. Nowadays, it can be done with the laser surgeries. You can coagulate the membrane and separate the anterior portion of the tongue so the tongue can be freely moved and it can be touched to the palate. How much should be the tongue freely moved? When the baby is trying to take the tongue out, it should come to the outer edge of the lower lip. Is the adequate movement of the tongue. When you should be doing this surgery? When the baby starts uttering word, monosyllables, ma, ba, da, ta, that is the ideal age to go for this procedure. So, when you are rehabilitating the baby or you are going or dealing with occupational therapy afterwards, after the procedure, it is very easy for a baby to get accommodated with the new pronunciations. So, in your life, before entering to the field of occupational therapy or speech therapy for your baby, for the complaint of slurred speech, altered speech, delayed speech, or lack of proper pronunciation, always rule out the condition called as tongue tie. Tongue tie nowadays is not a big operation, it is a daycare procedure. So early morning, bring baby fasting, get your procedure done, and evening you can go home. It is very painless procedure and very useful if you do it at proper particular time. For more information, you can contact the number flashed down below or you can visit our website. Thank you.